All right, you're set.
All right, and we'll give people a little bit just to get into the session, and then I'll introduce you. Alrighty, we'll go ahead and get started. Welcome everyone. This is the session on congregate living facilities and infection disease management during COVID-19 lessons learned. Our panelists today are Carol Hollowell, Sarah Strang, and Lauren Navidomskis. It's also L-Dog, as I have been told. So what we'll do is the panelists will go ahead and take it away with their conversations, but you are more than welcome to ask questions during this presentation. What you will do is you will raise your hand, and then myself or my associate Lainey Myers will click on you, and then we will let you know that you have been unmuted, and then we will make sure to let you know, and then you can ask your question, and then we'll mute you again. So go ahead and take it away. Thank you very much.
Well, welcome everybody. Should I go first, Sarah, since I start with a C? We'll do some quick introductions about ourselves and our organizations. I'm Carol, and I'm from St. George, Utah, of course, but we're on the sunny side of the state, but that doesn't mean that we don't have a homeless issue. So Switchpoint is a community resource center that has an emergency shelter, emergency food pantry, housing assistance, and we do a lot of community resource centered classes, as well as micro enterprises. We have a social detox on site, as well as a substance use disorder treatment facility up in Hilldale. So we've been really busy in our first 6 years of business, and as well as just expanding to Tooele. Some of the things we'll be talking about today is really how did we take that congregate living situation and pivot and adapt to a pandemic. Not something I thought we'd have to deal with in our first decade of being opened, or if ever. And so some of those things we'll be talking about as far as overviews and how did we react, I think are going to be still in the forefront. We're still in it, and the numbers are still high. And so how do we keep adapting as shelter operators and direct line staff? We know that we're essential. All of us on this panel have essential shelters that have to stay in business no matter what. And I think some of those big questions that need to come to mind are, how do we keep our staff safe? You know, how do we keep our clients safe and our residents who live here? And how do we, more importantly, I think, keep our community safe when we are in a pandemic and we have maybe a lot of clients that are not coming and staying in shelter because they don't want to spread something, but maybe they are at risk of spreading in our communities. So those are some of the things that we're going to be prepared to talk about today. So I'll let someone else introduce themselves.
All right, we can go across the panel, although I don't know if everyone's in the same order as mine. I'm in the middle of Lauren and Carol. But so my name is Sarah Strang. I'm the Deputy Director of Crisis Services for the Road Home. I oversee all of our emergency shelter programs, which includes the Midvale Family Resource Center, the Men's Resource Center. We just opened up St. Vincent de Paul Overflow this week. And then we're working in conjunction with the county on the Vulnerable Populations Motel for those who are over the age of 60 and at high risk for a congregate living situation. And to second Carol, we opened the MRC at the end of November, and 3 months later had to completely shift everything we were doing as we realized how quickly an infectious disease can spread. We had our first case and quickly skyrocketed up to just below a 50% infection rate in our facility at the Men's Resource Center. And there's a lot of pivoting, and we initially started with, gosh, we just need to get to June. And now we need to get through the entire year. And so really looking at long-term strategies and implementation, always pivoting based on what is coming out, the newest information that's coming out, but also the challenges of COVID fatigue and the challenges of wearing a mask and all of these pieces that have been put in place, and how do we keep our guests engaged in the safety procedures that we need to have happen. So, and then I'll pass it on to Lauren to introduce.
Awesome, thank you. Like we said before, my name is Lauren Navidonskis, or L-Dog Navi, as most of my staff call me and my friends and family, but I am the executive director of Lantern House, and we are a homeless shelter and soup kitchen in Ogden, Utah. Our homeless shelter has 330 beds dedicated to single men, women, and families. And then we operate our soup kitchen where we serve 3 meals a day to those experiencing homelessness, and a lunch meal to those in the low-income community. We have also had a very interesting year with the COVID-19 pandemic. This is about 4 months into year 2 of executive director. So I stepped in and thought, wow, like I've got a lot to learn, but then COVID quickly taught me that we're all learning, no matter how many years of experience we have under our belt, and you know, really looking at a community-wide approach to ensuring that our homeless population is being safe and trying to slow the spread of COVID-19. Within our facility, we have a variety of programs to assist individuals wherever they may be in their homeless journey. We have housing programs, critical need programs, and case management services for individuals in all walks of life. So I came from the case management area and grew, so I have a deep desire to serve, and I like to take this homeless issue to an individual person's experiencing homelessness and really try to solve it that way. I'm very lucky to be in the community that I am. Weber County is equipped with phenomenal service providers and city and county officials that are on board in responding to the homeless crisis, as well as the intertwined of COVID-19. We have had a much different experience as Sarah and the Salt Lake community of homeless individuals experiencing COVID-19, and we'll touch on that later on in the breakout session. So I'm excited to learn and ask questions from the community. So.
All right, Carol, do you want to tell about your COVID experience? And
Absolutely, yeah. I'll just kind of start with how did we react after the tears and stuff. Then we had to kind of pull together. But I think that we can say that we had to establish quickly a flow chart and protocol so that we could adjust quicker. And obviously that flow chart and protocol was changing every week. So we were meeting weekly with IHC, which was our lead healthcare provider, and with the public health department. And we were lucky because one of the board members I have is the COVID contact for the hospital. She's the director of nursing at IHC. And so we were really blessed to have that on hands, really engaged attitude, if you will, of, okay, here's what we need to do. And so that was kind of the first thing that happened when COVID hit. I kind of wrote down some lessons learned, and I just thought, it's always going to change. Like say we get a second pandemic or another crisis, a fire, a flood, something else that comes on. But I kind of broke these out into 4 different categories. And one is we were not prepared for the magnitude, both in reaction, supply chain, and the ability to refocus. This taught us a lot of things about let's get prepared. And I think that that's helped on our local homeless coordinating calls every Thursday with state leaders, is to say, how do we as a county have that already in place so that the next time we're not scrambling as much as we did now. I would echo what Lauren's saying on having the strong interaction with our county and our city leaders, is to have them at the table, constantly at the table. Our lesson number 2 was we didn't have those partners at the table immediately. And we had to learn that the county and city emergency planners, economic developers, commissioners, mayors, healthcare and health department, all of those needed to be contacted immediately and connected to us for it to be an effective process and in a timely manner, so we weren't always behind the ball. So that to me was speaking volumes of not only do we have to be collaborative with our other agencies that help us with homeless services, but we better have the big dogs at the table, because that's where the funding comes from, that's where our supply chain can come from, and that's where we can get extra help that can help us pivot immediately. An example of that is that the city of St. George had owned a hotel that they were going to demolish and then build something new on. So they just purchased it during that year of 2019. And so it was vacant. And when COVID hit, we immediately put out our plea to help. And so they said, all right, here's the deal. We'll donate you the space, meaning there's no charge. We just immediately took over, staffed it within 2 days, put up some policies and procedures of how we were going to work this as a quarantine and isolation hotel. And that would not have happened as quickly in a private situation, right, with a private owner. But because the city is already a great partner for us, then we were able to make that happen within a matter of days. Number 3 is statewide cooperation is a must. And we all learned that, I think, that are on this call, is that counties and cities that are not participating on those state calls, they're missing out on a huge collaborative mission that's been helpful for the majority of us. And we've got to take away from the agencies that are maybe politicking or have an agenda and say, we're all in this as one voice and one body. And that became really evident. I don't know about the rest of the panel, but those weekly calls have shown us that as a state, we can be super collaborative when we're looking at how do we react to this as a whole body instead of just one area at a time. And the final thing that I can say for SwitchPoint is our homeless friends have taught us that they're the most resilient. They're the most resilient of all. Our staff, donors, and volunteers have struggled with fatigue, compassion burnout, definitely COVID burnout. But how interesting is it that our homeless friends have been the ones that have been strong and steady, because this is what they face daily, and they're looking at us like we're a bunch of babies, right? So I felt like we learned a lot from them. And yes, sometimes it's hard to ask them to be compliant with mask wearing, but on the other hand, they didn't react in a crisis mode like maybe the rest of us who haven't had to live with crisis day in and day out. So those are kind of my 4 top lessons that I wanted to share, and then we'll get into maybe some of the other big things. One example of having to pivot, and we had operated our soup kitchen at a church, the Grace Episcopal Church, for 7 years. And when COVID hit, we had to immediately decide, when churches had to say that they wouldn't have any patrons inside the building. That meant that our 120 people that were going a day to get lunch were not able to use a bathroom facility. They had nowhere to sit. Our summers here are extremely hot, so we're in triple digits, and you're trying to eat a lunch, and there's no tables and no chairs. You're just outside standing in a line. And our bus route only comes around every hour. And so we had to immediately make a major change and say, how do we serve still in a food crisis situation and make it more safe and with dignity, and allow people to still use a bathroom. So we moved our soup kitchen in June to back to campus, even though it had been there for 7 years. So those are some of the things that we really had to just stop, drop, and roll and pivot. So that's what we've done.
Carol, how many folks do you guys serve out of SwitchPoint in your emergency shelter every night?
We have 84 beds, and then we have the capacity of 20 in the hotel.
Great, thank you. Okay, are there any initial questions for Carol? All right, I'll move on and talk about what we saw over at the Men's Resource Center and what that looked like. So, let me share my screen. I practice this. Okay, so at the Men's Resource Center, we have, and at our Midvale Family Resource Center, we serve a max capacity of 300 folks every single night. It's a congregate style living. The Men's Resource Center has separate dorms with anywhere between 40 and 50 beds per dorm, whereas the Midvale Family Shelter is a large open space dorm with bunk beds that are assigned to family units. And so as COVID started and we initially began going on things, I agree with echoing Carol that collaboration with the county and with the health department was incredibly important, and Salt Lake County came together and formed a COVID task force for vulnerable populations. And in March, I always say that Ricky Rubio is who really, not Ricky Rubio, it was the other jazz player, but he really kicked things off as he started the infamous COVID positive case in Oklahoma City, and they stopped playing the NBA directly after that. I think that's really when it became really clear to a lot of people how serious this was as we started looking at that. And Salt Lake County was really quick to come together and to get a task force of providers, of experts, folks at all levels of government, so that we could look at how we were going to help these vulnerable populations in our community. And we had some pre-planning that happened, but on mid-April, we had our first positive case that came out of the Men's Resource Center. And immediately we had started implementing things like temperature checks. We had stations set up at the front desks where we were taking temperatures every time someone came in. We were asking about symptoms. We had looked at what were the essential functions within our facilities that 100% had to keep going, and where could we redeploy staff if needed, so that these 300 single individuals and 300 individuals who made up families would have somewhere to stay every single night, really focusing on those essential 24-hour functions that needed to take place. And when we hit our first positive case in mid-April, we quickly found that congregate living has some challenges in terms of infectious disease. We went from one positive case to just under 50% of our population being positive at the Men's Resource Center. It was a huge lift in conjunction with our local health department. That was just fantastic, but moving 100 positive men within a couple of days' time into different quarantine and isolation facilities was an immense amount of coordination and challenges as we looked at those different pieces. And as we all know, in working with folks who are experiencing homelessness, oftentimes you're relying on that relationship with them and getting them to be able to go to the quarantine or isolation facility, because the change is scary and it's not something that they're comfortable with, and looking at that. And we had a lot of lessons learned about really the things we hear the most about right now, which are social distancing and mask wearing. Those started to become normal terms that we talked about. We took out half of the furniture that we had for folks to gather, so that they were gathering further away from each other. We started to limit the number of people who could eat at any specific time to no more than 30, because we could have 30 tables with one chair and 6 feet in between them in our dining room. So meals went from taking an hour and a half to serve to taking 2 to 2.5 hours to serve, so that we could cycle everyone in and get that in. And the biggest challenge that we have faced within the COVID-19 is that we now have to make sure that we've extended our bed reservations. So one of the things that we found key and early on from the health department was, because we rotated beds every day, we had inadvertently increased the spread of COVID-19, because one individual could be sleeping around new individuals every single night, and the spread just went really quickly from them and from that point. So we've had to make modifications all the way across the board, from what it looks like when you enter into the facility now, which is stickers across the ground telling everyone where they can stand, how they can line up. We looked at queuing. Where are people queuing and what are they queuing for, and how can we change that process so there's no queuing anymore? We've completely revamped how we assign beds and what that looks like. They now get a bed for a longer duration to minimize the rotation of who's coming into the facility. And so we're seeing that on a much lower basis as we looked at all of those different pieces. We've worked really closely with our health department to have weekly testing events, and also in partnership with 4th Street Clinic. That community health aspect has been incredibly important as we've looked at navigating an ongoing understanding of where we are with COVID in our facilities at any given time. Also in conjunction, knowing that we're now heading into the flu season. And so what does that look like as we've partnered with the health department and with our community health providers such as 4th Street. So every week we test about 70 guests and staff on a random testing basis, or as identified by maybe folks who are new guests that are coming in to stay with us that have not previously tested. We changed everything for our bed management. Our guests no longer have to queue or come and let us know that they need a bed. We've completely moved all of that responsibility onto the back end, so that guests are, as long as they're coming in and utilizing the shelter service at night, they're able to continue to access their bed. We've taken away a lot of those different component pieces. We go through the facility every single night and check everyone's temperature. It's part of our nightly check-in. So we have a log where we check temperatures, and if someone is experiencing symptoms, if they report that they are experiencing symptoms, we have small studio rooms that are just a 1-bed room that we can move them into until the next morning when we can go and get them tested. Again, the 6 feet, really looking at community areas, furniture, encouraging our guests to be outside. With our kids down at the family shelter, it's been an interesting piece as they have started to go back to school. So we're doing temperature checks every day before they get on the bus. I will say that a lot of what we spent September doing is navigating the school response to COVID and students who have been identified as sitting next to someone who is tested positive for COVID, and how does that translate into the congregate living setting and how we can get them into a quarantine facility. And then the other piece is looking at masks that are required for all staff and guests throughout. And that's something that initially was a little bit challenging to get on board, but now we're there and working with everyone consistently to go back. It's funny because we hear the same two things pretty consistently, and it's been since the beginning, which is wash your hands and wear your mask. And sometimes those don't feel like the most comforting pieces, but it's really the piece that we've seen the most effective in terms of those different parts. One other aspect that we have looked at utilizing is identifying vulnerable people who are coming into our shelters and that we know they're at much higher risk of having extreme health complications should they contract COVID-19. So if you're over the age of 60, we have a vulnerable populations motel that can house just about 120 people, both male and female. For single individuals that we are able to utilize to get folks who really should not be in a congregate living situation into the motel. And then our goal is to get them from the motel into their own housing situation so that they're not returning to a congregate living situation. And then similarly with our families, if we have a family who's coming in who's high risk and should not be in a congregate living situation, we have moved them into a motel as well, and we continue to work with them from there. And then just lots and lots and lots of cleaning, high contact area cleaning. So,
Sarah, I've got a quick question for you. Has it been harder to get the staff or the guests to wear the mask?
Oh, it depends on the staff and the guest. But it is challenging, and you know, masks are uncomfortable. They're uncomfortable, and they're not necessarily the most pleasant to wear. I'll also say I've spent a fair amount of my money on lipstick, and no one can see it when my mask is on. All of those different pieces, but it's definitely been a challenge, and we're constantly talking through what is your barrier around wearing the mask. Is it that you feel like you can't breathe? We had a staff member who was very resistant, and then it turned out there were some health complications. She only had one lung, and especially initially when the masks were those double or triple layer cloth pieces, it was really hard for her to breathe, and she felt like she couldn't. And so really being dynamic and thinking outside of we don't have a lot of face shields. Supplies are still in short demand. And actually, Carol, I can remember one of our state calls first on where you guys were talking about making your own hand sanitizer.
That's right. We have regularly. Yeah. It's a little runny. It's a little runny. I didn't get as much aloe vera as I needed, but
we all did have to just be so innovative and know that we only had a certain amount of limited supplies of different things. And so how are we navigating the use of those different pieces? And I also know that in Salt Lake County specifically, we've had a very strong and robust response from our health department with different quarantine and isolation facilities. That was not something that was available in the other counties. And so how we've each had to navigate that has looked somewhat different. All right.
All right, L-Dog, you're on.
Heck yeah, here we go. Okay. All right, so very similar to the two ladies that have gone before me, the positive COVID-19 test from Rudy Gobert really kicked things off and kind of brought it home to a lot of us. There were early discussions of, when will it land here? What does it look like when it lands here? And, I believe that was like a Tuesday or Wednesday night when that kind of came about, and Lantern House first experienced our COVID-19 that Friday night, Saturday morning. I received a call from the local hospital saying, we have one of your guests and they're under investigation for COVID-19. And I was like, well, here we go. And so I made a quick call to a couple of my board members who then contacted city, county officials, local health department, emergency planners from the city and the county, and our local low-income medical clinic, Midtown. We have Hope Clinic, which is located inside Lantern House, so they're a component of Midtown. So we all got together one Saturday afternoon to really come up with a response to not only this one guest that was under investigation, but what it looked like for ongoing guests and testing. And it was a very long meeting, and from the city and county perspective, they weren't quite sure what it looked like to, for those experiencing homelessness. And so it came down to a lot of education on how congregate living styles, can cause this issue, and waiting for meals can cause issues, and the transferring, so many things. And so it quickly was decided that individuals who were positive for COVID-19 would not be staying at the Lantern House, that we would need to identify a place within the community for those to quarantine and isolate. We know that in our population, it's very transient. They're very transient in nature. And so trying to find a place that was, very trauma informed and kept the guests, the guest rights in mind, and made sure that they were safe. So from that meeting, the county and city identified an old facility within our community that is now called the 210 facility, where individuals who are positive for COVID-19 or under investigation for COVID-19 will go. It is staffed by a neutral third party from the county. So they've hired a team that when we open that up, they come in and work. And then it's been a bunch of service providers that provide different things. So, Lantern House is in charge of providing the linens, and the food. And then our Youth Futures helps with the staffing, and Weber Human Services, our local mental health, is focused on harm reduction and the mental health of the patient. And so it's really been a collaborative effort there. So, and that's kind of how we established our 210 and our quarantine facility. And so there is a picture of it on the right. So we really adapted to that pretty quick. The first couple of guests that went into 210 were not positive, but at the very beginning of this, we were experiencing test results that would take between 5 and 7 days, and they were being held at Lantern House in a place that really wasn't the best for long term. We, only certain guests could go back there with certain PPE, and so it was myself and another staff member that would only be going back there, delivering meals, trying to keep the guest happy while they awaited results. And so if a guest was not willing to stay or whatever, we would activate the 210 to kind of give them more of a homey place to stay. And so I think that was one of the earliest and most difficult challenges, was the length of time for testing for our population. And so with the support of our local health department and Midtown Community Health Center, we were able to get a rapid test machine in our facility where we can get results within half an hour. And so this has been, vital to our guests and our staff that are experiencing symptoms can rapidly get a test, and we can react as quickly as possible. So like the other two facilities, we quickly had to change what operations looked like and how we delivered services. And so one of the main things that was adjusted was our check-in protocol. So we run a 3-hour guest check-in where we are, searching belongings, breathalyzing, ensuring that everyone gets up to the dorm. But we had to take away the breathalyzer due to, sanitation concerns and things. And we were only allowed 6 guests in our lobby at a time. We were doing temperature readings before they would go up, and we're still doing that to this day. So early on, it began where we had the Hope Community Health Center there doing temperature readings and asking symptomatic questions. And, I've, to echo again what others have said, I really have to give it to our guests. It's a very, difficult process to wait in line for hours just to get a bed, to adapt to the protocols needed to keep our facility and our staff and them safe. And so we test, or we temperature read everybody and ask for the symptoms, and are continuing to do that. And if an individual is experiencing symptoms or does have a temperature, we have a set aside room right off of our lobby, and for some reason, our staff decided to call it the pineapple room. Maybe it's a code word, or, just to protect the staff. So the individual will be placed in that pineapple room, and then we have Hope Community Health Center on call to come in and test, to do that rapid test, to then transition them to isolation, or give them, if they test for the flu or whatever. So they do a handful of things to rule out what's going on, and then from there we react and put them where appropriate. So that's kind of our shelter check-in operations. We've had to dedicate certain beds to our 16 older population, and really separate certain like bed spacing. We have individual dorms. So we have a men's dorm, a women's dorm, and a family wing. So they are already separated, but then it's now bed spacing, and they are allowed to keep the same bed during their stay. So we were very fortunate with that. But again, every day presents different challenges. The other thing that Carol kind of talked about was our meal service. So we, like I said, we serve 3 meals a day, and lunch being the entire community. And so we quickly, on that March 16th emergency response day, we went to complete sack lunches. So all sack lunches are prepared and distributed from our soup kitchen. We don't have them come in for congregate eating or anything. And I was really nervous because I didn't want our individuals to get tired of eating sandwiches and tuna salad and things. And so with the help of, our local Bishop Storehouse and Pamela Atkinson, we were able to get some funding to support USDA compliant meals. And so our kitchen has been very creative in responding to hot meals in the bag or in a to-go tray, to ensure that people are getting adequate food. And it's definitely been interesting, but we've definitely made it work. And then, like these ladies have said, encouraging mask wearing within our staff. So right now our staff is all required to wear masks, and we are encouraging our guests to wear them. If interacting with any staff member, the guest does have to wear a face mask, and we do have our sneeze guard shields and things for one-on-one case management. We did have to kind of delay that for a little bit because we weren't quite sure how to respond and how to keep everyone safe. So we did virtual case management sessions. We really wanted to ensure our guests weren't being left out or not served. And so we really tried to come up with the best ways possible to ensure their access to services. My biggest thing, and it's been touched on again by these 2 ladies, is these individuals are experiencing a homeless crisis on top of a pandemic crisis. And so we want to ensure that we can help and aid their stay in any way. And it's, I really have to give it to our guests and our homeless population that have responded very well and listen and are very respectful. I mean, as many of us are tired of this, they're the ones that are seeing the constant changes, and getting that communication out there has been a difficulty. Some of the lessons learned and things that we're still really trying to work through is, staffing. There's a lot of funding to support COVID-19 response, but we're struggling to get people that want to come in and work. And a lot of people have referred to homeless shelters as the COVID-19 petri dish, and so it's very difficult to get people that want to come in and work. So it's now looking at current staffing and how we can adjust job descriptions, but then continue to serve in the capacity that we need to. We also have a lot of resistance of coming into shelter on our guests. We have not a very busy road right in front of our facility, and it has begun to grow and as a camping site because people aren't wanting to come in. They're not wanting to wait in line. And so there are problems with our street and the, how do we serve them? How do we explain to them what's going on, and how do we get them into shelter before it can be a huge problem? So those are definitely some of the stressful components of it. And I think very, very differently than Salt Lake is Lantern House, or our community, has tested just under 110 of our homeless population, where Lantern House has served about 1,200 since the pandemic has begun. And so now this looks, on my end, it really looks at having the conversation of testing events and making sure people, our guests, have access to testing so we can get a real depiction of what COVID-19 looks like in our community. And I think just like these two ladies' facilities and our own, our staff has been really, really phenomenal in responding to COVID-19 and showing up every day and ensuring that the guests have the best experience while keeping everyone safe. So that's really all I have on our facility. And I would love to answer any questions now, or we can open it up.
Really quickly, Lauren, something you said that I think really resonated, and we've talked a lot about how our guests have been adaptable, but I'll also give a shout out to staff. Our staff have just been unbelievably phenomenal. Our frontline staff who are taking temperatures, our case manager staff who are taking temperatures, who are transporting families to be tested, or potentially working with guests that they know are positive and getting them out. They really have been phenomenal as well. So a huge shout out to all of our case managers and frontline workers, because this pandemic, we couldn't have done it without them. And our guests wouldn't have received the services that they continued to receive and needed to receive, while the flexibility of doing it either virtually or from behind a plexiglass happened.
Absolutely. Yeah.
It is hard, because even though I think we're all trying to adapt as quick as we can, my overtime has been unbelievable. We've not only had a lot of clients, so we've had over 260 clients at our quarantine isolation hotel that were either tested negative or where they were still patients under investigation. We call them the PUIs. But so we've really struggled with making sure that we have staff that's available, because we've had a high number of staff become COVID positive. And so I know that, for people that might be on our webinar is, how do you adjust to that, as an agency? Because that's tough. Not a lot of our grants pay for overtime. And so without the state and county support, and city support of saying we need COVID money to help with our staffing, it really does take all of us in that effort to say, no one really wants to work in the COVID hotel, right? They call it the Corona Inn. And, and so you really have to find somebody who's desperate for a job. And when we were looking at this originally and people are getting the extra $600 a week in unemployment, boy, it's tough, and I don't know about Road Home or Lantern House, but it was tough to find additional staff to open up that operation until that stimulus package ended. And then now we have people that will actually apply again. So, I know it's a big issue for all of us that are, kind of on that front line, and how do we keep our staff numbers, full enough that we're serving.
I think too, one of the difficulties, I mean, speaking from Lantern House, we're a very tight-knit staff, and we love our get-togethers and our staff meetings. So because, it is focused around the facility, but then we do try to make it enjoyable and, have a meal or something around it, and to really adjust to, not being able to get together and how to serve meals to our staff. And, the staff morale has been tough. And, I've said this in board meetings since it's began is, our staff and the homeless community don't get enough recognition for being there every day. I mean, I completely feel for the medical community that's day in and day out dealing with this, but oftentimes homeless service providers are considered essential. And so really trying to benefit them and be there for them on a limited budget. We don't have to pay, tons of pay for hazard pay or getting them together for lunch. So the staff morale honestly has been one of the hardest things. And I know a couple of my staff are on here, and I just continue to say, there is no book on how to survive a pandemic as a nonprofit. So everything that I'm doing is day to day, and it's not just for me behind a seat, it's for each of you and for the staff that are there. So, if you are listening on this webinar, I think from a administrative standpoint, we are here for you. We are advocating for you. We're in this fight together, and it's a difficulty. So,
yeah. sometimes I feel like we're doing that little river dance, and we're going, our little legs are going as fast as we can to constantly make a change when we need to. But I would agree. One of the things that we just did recently, because this has dragged on so long, and I see that compassion, fatigue and complete burnout, is we just every Thursday now we'll have a mindfulness class that employees can jump on for an hour. And I think that that's going to, it's looking for things like, Lauren, like you're saying, to show them that we can see it and we appreciate them and we know this has been hard. Those are important things that we all need to kind of remember as we say, how do you get through a pandemic? It's taking care of our own just as much as we're taking care of our clients.
And speaking, go ahead. And I mean, I can speak for myself on this. I know there are days where I wonder why I stepped into the job I did and what I can do. And so, I have to really give a shout out to our community. We have a bi-weekly meeting amongst shelters and nonprofits, and it's just for the executive director. And we get to sit and kind of talk about, current happenings and things, but they always give us like the last 15 minutes to kind of just vent and really get it out there. And I think, we're all fortunate to have our homeless network call as well. It is almost like a vent session of, oh man, I'm running into this or to that. And so I think that the outside community and our city and county officials hear us and are there for us. So, I specifically have to give a shout out to our community and the response to meetings and hearing out the nonprofits. So.
Absolutely. One of the things we've engaged in is we have Utah Health Policy Project, I want to say it is. They come out, they have therapists and clinicians that come out. They have come out multiple times to our facilities. They talk with guests, they talk with staff, and it's been really fabulous to be able to have them there to help support, especially as we've had a small number of guests who have passed away from COVID, and what has that process looked like as we've been able to help the community mourn the loss of their peer and of someone that they cared for, and looking at those different pieces, and our staff as well. It's always difficult when someone you've worked closely with and they pass away, and those different pieces. So we've really reached out to a lot of community partners to come in who have helped and assisted us with giving our staff a space to talk with them, our guests a space to talk with them. And it's a little bit outside of the norm of just being able to go and share whatever it is that you're feeling, versus I feel like so many of our COVID conversations now are based on how many times an hour are we cleaning the bathrooms, because we're worried the bathrooms are a hot spot.
Yeah.
And those different pieces. So being able to help support them from that emotional standpoint of just that they have heavy jobs, and there's a lot of different components that go into it.
Yeah. One of the things I realized that I better do as an executive director was reaching out to some of our community business people and seeing if they can't help, maybe just be spontaneous. And so yesterday I got a bunch of coupons in from a Minchie yogurt shop who says, we appreciate your team and your staff. How many do you need? And so I say, here's how many employees I have. And so to me, it's really engaging, Lauren, like you were saying, is engage our entire community. Because they're all stakeholders in it, right? And what can a business do to say, I know you guys are frontline. None of us have ever gotten to go home and do, work from home. It's just not something we can do, and we got to stay open 24/7. And so I think things like that, where we got to really search outside of the box and go, what could we do to make sure that we're taking care of our staff as well?
And I also think recognizing the successes that we've made. I mean, we went from our initial burst of COVID to implementing changes across the board. And now we're seeing very, very, very low rates of infection within our facilities. And so also recognizing that all of this work, all of the engaging we're doing, especially with clients who maybe are like, I don't want to wear the mask, I don't want to do that. And all of having those conversations multiple times, but we're seeing the rewards of that. And we're seeing that hard work as it's coming through, and seeing the reduced infection.
We do have a hand raised from M, the letter M. I'm going to go ahead and unmute them. Go ahead and unmute yourself.
Hello, letter M.
maybe while we're waiting to see if M is able to get on and ask their question. One of the questions that has come up is, how did you engage, and specifically, I know Carol, out down south in the counties that are more rural, you guys have really had to engage motel and hotel owners and being willing to quarantine families while you waited for test results.
Yeah.
That have not had any luck getting motel owners on board if COVID is even suspected. And so I was wondering if you could speak to that process and how you were able to engage those motel owners.
Yeah, sure. I think that for us, we were looking at it from a standpoint of, do you want our homeless population, right, our friends, to be out and walking the streets and touching everything and contacting, being able to spread it rapidly, or can you help us out here and let's quarantine them? We're going to provide all of the food, and we'll provide the transportation, and we're going to provide staff, and that really help them realize the hardest thing of all of a quarantine or isolation hotel is to say, you're going to stay here for 14 days and you're not allowed to come out. And the client's like, what? But we said, you get TV, which you don't ever get, right? You get TV, you get 3 meals a day. Just call us if you need a snack. We'll go get your meds. And so it showed the hotel owners in our rural areas that we were serious about making sure that their property wasn't going to be damaged, but it would ensure that their community would be safer. And so I think it was just painting the picture a little differently than just saying, hey, I need a couple of rooms from you, and I'm going to stick all the COVID people in there. Is more of, we don't want the COVID positive people to be in your community infecting more, and this is a great way to keep your community safe, and we will do XYZ to make sure that the client is happy or staying put for 14 days. So we just changed the rhetoric.
Yeah, I think that's such an important piece when we're really looking at how are we engaging these stakeholders who maybe wouldn't normally be participating with us in that manner, and on a topic that is scary when we're talking about, can you house someone who may or may not be positive, but we need this time to find out.
Right. The other piece of that is really engaging your law enforcement to help, because as they're out and about and doing outreach and they find someone and that homeless friend is sick in the park, and they really were calling us to say, hey, we've got someone that really needs some help. We were able to then coordinate transportation, which again shows really good faith to the community that we're trying to take care of our community as a whole. And so by saying, we'll come and get them, we've got a van that we can, we've got all the PPE and we've got the staff that's been trained to do that. We'll transport them, and we'll get them into the necessary quarantine area. And I think that speaks volume when you have that many partners at the table looking at how to keep not only the individual safe and healthier, but how to keep our communities healthier.
Absolutely. Were there any other questions from participants?
Maybe Emma's back.
Go ahead.
Yes, I am. Thank you. So I was just recommending that I noticed Michigan had provided tuition assistance for frontline essential workers. I think that would be great if there's an opportunity to advocate for it. Thank you.
Absolutely, I agree with that 100%. Looking at how, going back to that broader community spectrum, how is it that we can provide those incentives for our frontline workers? And also, Lauren, you'd mentioned this earlier as well, that a lot of importance was placed on frontline workers in hotel or in hospitals and working one-on-one, but also understanding that our frontline workers in any of these congregate living facilities are also putting themselves in risk for that, and what does that look like from the community standpoint as a whole. So I think that's a fabulous approach.
I think, and I would love to hear from Carol and Sarah, I think one of the things our agency experienced and we're still experiencing is how to communicate the changes of our operations to our homeless guests. We don't have all of our guests don't have phones, and we don't have a response system where we can send a text that said masks are now required, or check-in will be changed, or things like that. And we first kind of thought about this when we're, or in the middle of a pandemic, and then we experienced our earthquake of trying to get people out, and are people able to come into shelter? And
Yeah.
so we still are trying to figure out how to best communicate the changes to our guests. And so I'd love to hear how you guys have implemented that into your agencies, or what you've done there.
Well, one of the things I think are quick and easy is when we have to make a change. And in the beginning, we were changing weekly, right? Because none of us really knew in the entire state what is this looking like and how fast was it really going to spread. But I think that flyers and posters on walls are okay. But what's more important is we would print off weekly to hand to the resident, that was staying with us in our shelter. Here's what's new this week, and we're so sorry. And by the way, here's another mask because you probably lost your other mask. But we were constantly giving them the changes, on a little quarter sheet flyer, so that they had it in hand, and we would go over it with them every time they came into shelter. So it's really about saying you got to be expecting, as an executive director and a staff, to speak to them one-on-one, whether that's saying, here's the flyer, I can tell you the highlights of it, because we don't know, maybe everyone's literate, right? And so we would just go, here's the top 3 things that have changed today compared to last week when you were here. And so we really need you to kind of take part in this and help us out if that's okay. And so
I love that.
one thing that we see a lot, and this has been one of my big pet peeves and concerns, and a pet peeve in the way that it's just spread so fast, is picking up cigarette butts. Right. And we know that a lot of our homeless friends are going to wander the streets, and they dig through garbage cans, and they go through car washes, and they find used cigarette butts. And so we really had to kind of start this campaign of, that is a great way to get it, right? Because you don't know who was sucking the other end of the cigarette. And so we were really trying to help them realize what are the safe things that they can do as a resident, and not just a resident, but as a community member. And picking up used cigarette butts is not a good thing. It's going to help spread COVID-19. And so we just started trying to think of things that could help educate them, that was meaningful to them. And then we'd ask for their opinions. The other thing I'd suggest is we use some of our kind of team leads, meaning residents who usually seem to be the bosses of everybody else, and everybody's got them, right? Asking them what they thought was important for residents to know, right? Mm-hmm. And what have you been seeing on the streets today? What have you noticed on unsafe behaviors? And have you noticed more people getting sick in a certain area, And so we really tried to involve them in this process, and I think that's helped a lot.
Yeah, I will agree. I think that peer-to-peer support is really helpful. And one of the pieces that we did, especially when we were in the height of our first initial outbreak, information was changing hour to hour. What we talked with the health department about at 8 a.m., by 4 p.m., it could be completely different. And so it was very challenging to keep guests up to speed. It was challenging to keep staff up to speed, and looking at all of those different pieces. And as we've moved more into a new piece of, this is just how things will be for the foreseeable future, I definitely agree. We always do flyers. We do those pieces. Hard to say how many people actually read the flyers. I do have to. But we've also done a series of town halls. So we hold town halls. We invite our guests in. We want to know what their feedback is, especially because we've made some pretty drastic changes to our intake procedures and to some of those different pieces to minimize the waiting, to minimize any lines or queuing that was taking place. And so that has been really helpful to get feedback from them on that. And then the other piece, especially around guest education for changes, is the health department has been fabulous. They have some really great employees who actually have come in during our meal times and talked with the guests. So they've been able to explain to them why it's important that you wear a mask, or why it's important that you get tested. And even though you got tested a month ago, you're going to want to get tested again, and really go through those different pieces. And then we hold shift change every day for every single shift. And so being able to go into those and talk with our staff about what that's looking like, and how the changes are coming about, and why the changes are coming about, has been an important piece. But we've had to have a lot of flexibility, both for our guests, but also for our staff, specifically with school starting, especially down in our Mid-Val Family Shelter. Any given week, we can have 6 or 7 families that are quarantining because their child was exposed at school. And the coordination that goes into getting those folks from the shelter into the quarantine and isolation, and things always changing at the health department. So we've all had to really roll with the punches around those different pieces. But I will say that face-to-face giving of information where you can and holding those town hall meetings has really been key in getting that information out.
That's great. Thank you. I mean, I think obviously, I mean, we're pretty far into this. And so as a staff, we've adjusted, you know, what postings have stayed the same of hand washing and social distancing. And, you know, it's kind of funny. And I really wanted to encourage the 6-foot social distancing through our whole property, and with only 6 people in at a time, you know, the indicators would wrap around the building, and my operations director just got out there and pulled out a yellow bucket of paint and just put the X's all over the sidewalk around the facility. And he comes in and he's so proud, and he says, you know, he calls me Mother Goose, and he says, Mother Goose, I've got 250 X's around our property, and I pulled up every camera, and yet bright yellow X's to help encourage social distancing. And so
That's funny.
you know, it's a positive aspect. I would have loved to do it a little different, but sometimes you just have to handle it a certain way and make it work. And so I love the stuff
So
that
you're L Dog and Mother Goose. I'm never going to forget this panel ever.
well, I mean, I think it just shows that in the middle of everything, we like to have fun and remember that why we're there and do our best. So, but you know, I think it's important, the things you've talked about, the face-to-face communication with our guests and the input from our guests. We do have what we call RVs, or resident volunteers, who are the leaders of the populations that I think we need to utilize as, you know, peer-to-peer support, instead of, you know, asking them to carry the heavy duties that they do. So that's great, you guys. Thank you so much.
I think we only have a couple of minutes left. I just wanted to make sure that there wasn't any participants that had any other questions or comments.
Yes, we have about 3 minutes left.
Well, we could sing a song.
Well, I think in hindsight to that, maybe we can all end with just our key takeaway over the past, which we've already done a couple of those different pieces, but really thinking through just so many good points around infectious disease and changing so that there's enough social distancing. Our populations are mingling where they need to, but not where they don't need to, and looking at that. How are we looking at program policy and implementation around the board? And how do we continue on? And thinking through the next couple of months and knowing that we have flu season coming up, and really wanting to say how much I do appreciate how it has brought all of us as homeless service providers together in that weekly call, and being able to hear what each of the different communities can do and how different it is out in St. George and those more rural communities versus even what's happening up in Weber, where it's more urbanized, but still is functioning so differently than even Salt Lake County, which it neighbors. And so I think it's been really neat to hear just how everyone is approaching the pandemic and the different things that have come together. And Carol, one day you'll have to do a webinar on how to make your own hand sanitizer, because
There you go. Let's do a little class. Cooking with Martha. No, I think the number one takeaway for me is flexibility. You know, if we cannot be flexible as agencies, we won't make it through any crisis, whether it's the earthquakes or the floods or the fires or the pandemics. We have to be, you know, less rigid in our rules and policies when it comes to making a quick change. And so I think that that has been really evident throughout these state calls that a lot of us are participated on the flexibility of being able to change, sometimes hour by hour, sometimes week by week, because we just have to listen to what the experts are saying and then try and make that change within our own organizations.
And for me, I think a lot what Carol said, it's taking it hour by hour. And when I go home at night, it's easy to get overwhelmed to think about the next steps or what tomorrow might bring. But I think it's important to, you know, go to bed, wake up, put on new clothes, and approach the day as a brand new day, and encourage flexibility within our staff, and just making sure that we're adaptable to the ever changing COVID-19 pandemic. And, we've had floods, and we've had earthquakes, and we've had a pandemic at Lantern House. And so really just being able to adapt to whatever we can do and take it hour by hour. it's a very heavy burden, but I think it becomes a lot lighter when the flexibility is there and the positivity continues. So that would be my takeaway.
All right. Looks like we're out of time, Sarah.
Thank you guys.
Good luck.
Everyone is doing and be able to see faces, even if it's just our 3 faces. I do miss face-to-face meetings.
Yep.
So,
All right. Thanks so much.
thank you.
you.
Thank you, ladies.